My name is Laura Mann, and I was diagnosed with breast cancer a few months ago. It's been approximately 3 months since I started my whole process. I immediately had surgery and did a bilateral mastectomy. And after the mastectomy, there's about a 4-week waiting period, and then I started chemotherapy. And I'm currently going through chemotherapy. I'm over the halfway mark of my process. My process is actually 8 rounds of chemotherapy, and it runs every other week. So it's every other Tuesday and Wednesday that I go in for treatment. And I've so far gotten through 5 rounds and have 3 more to go. And then from there, I'll be having about a month break, and then we'll be starting radiation. And for me, that will be a 6-week process. Every situation is unique as far as the number of rounds for chemo as well as the number of rounds of radiation. So my specific treatment plan will be 6 weeks of radiation, and that's a Monday through Friday process where you go in each day for approximately 5 to 10 minutes for radiation, and then that runs for a 6-week period. And then from there I'll be done, so it'll all be behind me. For the typical chemotherapy protocol, which is what I experienced, or the general one, is you have 4 rounds of a particular combination of medicine, which is called adriamycin cytoxin. And this medication, the side effects are generally nausea, which is managed with the anti-nausea medication, which they've made huge advances in. I never had a situation where it needed to come up, but you do feel nauseated and just kind of a yuck feeling in your stomach. And then in addition to that, there's a lot of fatigue. There's also a shot that's given, which is called Neulasta, that boosts your white blood cell count. That shot produces a lot of bone and joint pain. That typically, though, lasts only for about a day or 2. It doesn't stay with you, which is nice. So that's generally the feeling that you have through that particular type of medication. Then the next 4 rounds, that is the general protocol, which is what I'm experiencing, is Taxol, and then there's also Taxotere, which has similar side effects. And the Taxol, you don't have any of the nausea, which is wonderful. You still have the fatigue, but what is stronger is the joint and bone and muscle pain. And that's where having the opportunity to experience Greet the Day is a wonderful blessing. I felt very comfortable with David, the massage therapist, in the fact that when I was standing there, I had my little cap on my head, and it didn't, seem to faze him a bit that I was there, without my hair. I know it's a little startling for people, I imagine, at first. I know it always was for me when I would see someone going through treatment, and it's something now going through it myself. It's hair. It grows back, and it's really not that big of a deal. And so I think it's really for somebody to kind of prepare themselves up front to know that they might see somebody either without their cap on and it's just their bald head, or with a cap on, or something. But I know going through the procedure on Monday, I was more comfortable having the cap on than I would have been laying there with my wig on and having so much. So actually focusing on areas I've found to be more beneficial, and that's actually what I had requested with him. Because of the medication, I had experienced a lot of discomfort in my lower back as well as in my legs, and so I had asked him to only work on those areas. The other piece that I experienced is because of having lymph nodes removed in my left side, I am not able to have any pressure done on my left arm because of the risk of lymphedema. So I had asked him to not do any work on my arms, and also not sure of the impact of the port, had asked that he kind of stay away from my upper back and shoulder area, and really focus on my lower back and on my legs. And it was a huge help, because one of the things that I experienced going into Greet the Day was I had a lot of that achiness, and after having the opportunity to do the yoga class and then have him help me with the additional focus on my lower back and my legs, I walked out of there with no pain, and I was floating on air. It was great, and it was amazing. It was amazing, and it definitely works, and it definitely helps to get through the discomfort. It was comfortable, but I found it was a little tricky with the treatment. I have a port in my left side, and I did not opt to go with expanders at this point and do the reconstruction work. I would imagine if someone had done reconstruction, it would be more uncomfortable and more difficult. The laying down part was easier for me, but I was just very conscious of any pressure on my port area. For me, I would appreciate the check-in of, as they're starting on a certain area, checking to see if it feels comfortable and should they continue to, and just look for that feedback. I think that certainly seeing massage be available in a chemo infusion center would be wonderful. In the center, you have quite a few people. In the particular center that I go to, there are typically five to six chairs of where the patients are sitting, and then generally each patient is able to take a guest with them. So in the room you can have anywhere from say 10 to 12 people, and it's a nice social area from a conversation standpoint. So that helps to ease some of the tension and anxiety that you might be feeling going in there, or as you're having your chemo put through. But to have the opportunity to have a massage, to have your feet massaged, would really help to ease, I think, the tension and the tension that you feel in your legs, and just kind of going through the process. Even though you're trying to relax yourself and get through it, there is still some anxiety that goes along, and I think it would be wonderful to be able to have that. The other piece is that typically the chemo lasts, at least through the breast cancer process, anywhere from 2.5 hours upwards of 4 hours that you are sitting there. So it would be really nice to be able to have a break in that, to have your feet massaged. It would be wonderful. And I actually was thinking, after we had talked about that, it would be, if there's any way to do that as a test pilot at our place, I think it would be great. I think it would be really neat. I think that the people would really respond to it well.
Hi, my name is Sharon. I was diagnosed with breast cancer 6 months ago, and I'm currently going through treatment. I've had my chemo and I'm just starting my radiation. Chemo makes your joints ache. It's just a byproduct of the stuff they're putting in you. Your knees, your elbows, your shoulders, of course, from stress, not from the chemo, but from the fear, that's not the right word, from the anxiety. Cancer is proven in early detection to be conquerable. We know that. Going through the treatments is not pleasurable, but you know you're going to come out the other end. But you still have anxiety, and that builds up in the shoulders and the lower back. But the joints are particular areas of where a masseuse can focus, because they are very, very, very painful and uncomfortable. I chose the facial over the full body massage because I had some extenuating circumstances where I have currently a colostomy and 37 staples in my stomach to close the wound, and I could not lay on my stomach. And the facial was wonderful, and a very invigorating part of it was when she massaged my head. My hair's growing out, as you can see, but at that time I was completely bright, shiny, brand new bald. And she rubbed my head, and I think your feet and your head is where all those little nerve guys go. And I'll tell you, it is so relaxing. It is just like, whew. And then she went down to my feet, and we know from having facials before or pedicures, when they squeeze the bottom of your feet, it just runs up your whole body. It was incredible, absolutely incredible. A massage therapist could help me by saying, breathe. I have a tendency to stop breathing. Not permanently, obviously, but to hold my breath or to take short, hyperventilated breaths because you're afraid of pain, so you don't want to take a deep breath. And so you do a lot of shallow breathing. You're in a chemo infusion center, even if it's a small private one. You are concentrating on that IV in your arm, and you're looking at those, not bottles any longer, everything's in plastic bags. You're looking at those, knowing it and watching that poison go in your arm, and that's all you can think about. And if you had a foot massage or a head massage, during that time frame, it would take your mind off it. It would probably let your veins relax, so at least the chemicals would get in you probably quicker and be done with it. But it would take your mind off, and it would just make you feel better. It would just make, it's not a bad experience, it's not a painful experience, at least in my personal experience with the chemo infusion. But it would make you be able to relax, because I don't know that you can really relax too much during that. It would be wonderful. Absolutely wonderful. The massage therapists are incredible. They make you remember and feel what it was like to be a whole human being before your body was invaded with toxic drugs and doctors speaking languages you've never heard. And when they touch you, it comes from their hands through to your body, from their heart to yours. And it just makes you feel whole again. I've spent a lot of time in the hospital. I would only wish that these treatments or this kindness could be extended to you while you're in your hospital bed.
Hello, my name is Karen Leos, and I recently underwent surgery for breast cancer and radiation in the past 6 months. It's been a very difficult experience from being first diagnosed with breast cancer. It's such a shock. It's a shock to anyone. And to go from there to surgery and then go to radiation takes months out of your life. It takes an amazing amount of energy to get through it because you are so distressed about it. Your body is just badly abused from the surgery, from the treatment, and you just wonder if it's ever going to be over and you can ever move on in your life to get back to where you were. You can't wear the same bra, you can't wear the same clothes, you can't sleep on the same side. I haven't been able to sleep on this side since I had surgery. I find I carry my stress mostly in my neck and probably my face and lower back. So the facials are great. We can just lie there and shut your eyes and have someone massage your face, or lower back and your neck area. If you can work on the neck area without moving to the side of the breast or moving down too much, it's good. Even the mid-arm area sometimes is, it should be off limits, because that area, it's usually numb from surgery, and it's a lot of women have a hard time ever putting their arm back up over their head. They have to go through therapy just to get their arm back to be able to raise up over their head. So in order to understand it, once again, you almost have to go through it. But the doctor said, "Can you put your arm up over your head?" And I said, "Sure." I went like this. I couldn't raise my arm at all, and I was shocked. So really heat, and I finally was able to get it up by putting the shower on my underarm, having the shower head hit me. And that's what it took, that strong hot water, heat, and I think heat is great for people going through any kind of treatment. You don't need a real firm massage, because most people, including me, they don't get massages all the time. So they're not comfortable with it. They don't need that real strong massage anyway. It's so sore and delicate and tender that even a slight touch is practically unacceptable. So when you get close to that area with your hands, you become, the person becomes frightened that you're going to go there. So I think that in order for someone to be able to be relaxed and everything, you should assure them that you shouldn't go on that side, and you have to be a lot more delicate with this person, because they've been so abused with the surgery and the treatment and everything that they can't handle real strong massage. So I would just try to avoid that area, make sure that you don't go anywhere near that area, but continue to, massage and give extra attention to other areas. If you lie on your stomach, how does the treatment affect the back massage? It's pretty well, it feels good, as long as you can't go near that area. You can't expect someone to be comfortable when you're getting close to a surgical site that is still probably very sore, and it's tender. A lot of tissue has been removed from that area. The more you breathe, the better you feel, and the more relaxed you can be. So I think breathing is extremely important, or saying that you should breathe is amazingly important.
Hi, my name's Martha Spikes, and I was diagnosed with breast cancer about 18 months ago. I had a double mastectomy, followed by 5 months of dose-dense chemotherapy and 7 weeks of radiation therapy. And I am doing great. As you can see, I haven't had any reconstructive surgery yet, but that's scheduled for about 6 months from now. We had to wait for the tissue to heal following the radiation therapy, and things look real good. My hair's grown back in. Before treatment, I always had full body massage, particular emphasis on the neck and shoulder area. After treatment, I have not had any kind of full body treatment at all. To begin with, you're very numb across the chest, and it just kind of felt odd. And even though all the scars have healed and everything is healed, it's you tend to be very kind of protective, at least I do, of my chest area. I haven't been in for any kind of body work other than having facials or just very light massage. Number one, I felt a little self-conscious about it. Number two, I've been slightly concerned about lymphedema. I had a very, very mild case, so I've learned to do the massage, and I have the garments that I wear when I fly. I have to wear them if I'm above 5,000 feet. I'm supposed to wear the garments. In fact, right now my arm's a tad swollen, but I've got such skinny arms that it doesn't really show. So that was a concern, particularly just going someplace where I didn't know the therapist personally and didn't know the background. So I have tended not to have any kind of work, although my shoulders could really use some right now. If the therapist were to tell me that she had no experience in dealing with lymphedema, or with someone who's had breast cancer, I would much rather they be upfront and tell me that, and there's a whole body they can focus on other than just this left side, and I would have much more faith in that therapist if indeed they did tell me that they had no experience. It would be much better. Right now I tend to carry it in my shoulders, and I think part of that is a function, it's particularly on the left side, and I think part of that is the function of this frozen shoulder, because your muscles tend to knot up because you're holding your shoulder at kind of an odd position so it doesn't hurt. So definitely neck and shoulders for me. In my fingers and toes, the neuropathy that was caused by, it was the second drug that I was on, which was Taxotere. And it never was severe. My fingers and toes tingled a little bit and got a little numb. The worst symptom that I had was bone pain. Typically about 3 days following the chemo, and then I would have one extremely bad day where basically I just took painkillers, and then it would decrease after that, and it was usually just one really, really bad day, a second day where I just kind of felt like I had the flu, and then after that it was fine. I chose facials typically over a massage for a couple of reasons. At the time I was still feeling very sensitive about my chest area, you're very tender for quite a while, and I just didn't want anyone kind of messing with me. Breathing techniques, when I was being pregnant and having my children, of course we went through the Lamaze, breathing techniques, and I actually tried to use those when I was going through treatment to help with pain control and just kind of help relax. And but it's much easier when you have a coach, and it doesn't have to be, okay, now follow me. I mean, it kind of becomes a natural thing, I would imagine, with the therapist, because the room's so quiet, you just automatically kind of start following the therapist. I love hot packs. I love them. I have one that I put across my eye. They're very comforting. Heat is very comforting, much more than cold. I think for, at least for me, with the therapist, and their intention in working with me, the words, kind of the key words I think I would want them to be focusing on would be healing, soothing, strengthening. I think those would be kind of primary words for me, because the whole process when you're being treated for breast cancer is you obviously you need to maintain your strength, and that's not always easy to do when you're not feeling well and when you're scared. And I know just in other aspects, and having people around me, it was, my friends who were able to be strong for me were the friends who really came through, and it was easy for me to be around them. And I know I probably used up more than my share of other people's strength, so that's a big one. And of course you want to be healing the entire time, and you just want things to be soothing and calming. I feel so much better if I could get this shoulder taken care of. I feel healthy. I've got plenty of energy, and I feel like doing things again. And I didn't for a long time. And it was more than, I think everyone kind of goes through a moderate amount of depression with the diagnosis, but it was more than that. It was just your body's just pooped. You're just tired, and I didn't feel like doing anything. And I feel healthy.
Hello, my name is Tracy, and I was diagnosed with breast cancer about 6 years ago, and finished treatment about 5 years ago, celebrating that 5-year mark in this summer. I have found on my x-ray, I went in for a lumpectomy, which turned into a mastectomy, thank goodness, and had 2 large tumors that were taken, and I also had 20 lymph nodes, all the lymph nodes taken away at that time. Found out on a Wednesday and had the surgery on a Friday, which was fabulous, the same week. It's a very quick procedure. I experienced 6 months of chemotherapy, and then followed by 6 weeks of daily radiation therapy. 3 surgeries for reconstruction, and as a little extra bonus from the lymph node removal, I got lymphedema and went through therapy for another year to work with that and to train myself how to exercise and keep that area in check. When I was treated, unless it wouldn't take a healthy breast. So now I'm constantly worried about the other side, and I've had a reduction on the other side, and they took half of the nipple on this one and put it over here. So when I have x-rays done and mammograms, the scar tissue on this side is worse than the other side. So I have to have constant tests to be sure that there's nothing going on there. So my biggest regret is that I didn't have both breasts taken. And I will always feel that way. Plus, you can get an even rack out of it. But yeah, that's something that I worry about. It would be all through the neck area, the lower back, which was also a side effect of the medication, bone ache from the tamoxifen that I was on for a long time before they had Arimidex. So the medication, those side effects, the tingle in your finger, the lymphedema, all those areas where I kept it. The tingling, it's gotten a lot better now. I don't seem to have it as much, but the part that's hard is the bone ache. If you're in a car and you're driving, even for half an hour, to this day, when I get out of the car, I look like I'm 90 years old. And then it gets better when you move around. But the bone ache is a definite side effect of the tamoxifen and the Arimidex for most women. I'm always very careful though on the lymphedema side, and that's why I loved it when I went to Gregory's, because I mentioned that to the therapist and she knew what I was talking about, and I had to be careful disarming. And she said, "You have lymphedema," and I just was just dreamy that I knew I could trust her, and she would have felt comfortable with me and the parts of my body that are altered now. I think that if a therapist told me that they had not been trained in lymphedema, but they were aware of what it is, that's absolutely perfect to me. And that they would just do light touch or simply not go in that area at all. That would be very comfortable for me. Just the fact that they're aware of what it is, to me, that's absolutely perfect. The chemotherapy put me into, what is it? Menopause. Thank you. It's amazing how you don't want to remember these things. Immediately, I have not had a cycle since the first chemo. So the hot flashes that come and sometimes are brought on by the warmth, and that is one area that I need to work through, because the hot flashes are sometimes just very hard to deal with. I have chest wall tenderness in both areas, and sometimes kind of ghost pains that come in. It's like a cramping in that area. There's definitely a tightness and a thickening in the lymphedema side. I have the skin is thicker on that area. My skin side effects, I'm now using lotions for the radiation side. That skin is very, very thin now, and there's a rash that's pretty much always there. And then as the weather gets hot or cold, then the rashes become much more irritated. I love the oil. I love oil for my massages, and I love the aromatherapy oil. It's just dreamy to me. I love the warmth of the hot pads and the warm blankets and the hot packs around my neck. That's wonderful. It's wonderful. I do appreciate, as far as breathing is concerned, to have a guide, a reminder to breathe, or just as simple as we go on. The whole body massage was extremely beneficial to me, because it was it was kind of like a luxurious, sincere embrace hug, if you will. It did everything from top to bottom. To me, that was, and the visualization to just kind of start from the top and let it go out the bottom would be better for me. Well, the first experience was new to me, and it was new to the ladies that I was with. When I got to come back, it was like you won the lotto, that you've been, oh my gosh, you get to come back. And this time I could look forward to that time, and I could bring the lady that I got to come with, I could guide her through, so it was very much more comfortable for her. She had never had massage, and I could take her, we could do this, we can do that, and just completely, my relaxation was heightened because I did get to come again. And I think that as I got away from the years of being well, to come in and just have somebody spend that time and make you feel so treasured and special meant more to me coming back later as you get away from the experience than it actually did before, because you get so busy and you're a mom and you're a teacher and and I just feel that getting to come back to greet the day a second time meant more to me even than the first time, because it made me feel very special. That makes me want to cry, because it really does.
Monday was wonderful. It was wonderful, and the timing was perfect, the setting was perfect, and it was just very much needed, and I just can't tell you what a wonderful program it is that you're doing. And to really be able to see the difference and the benefit in how it makes you feel, and just being able to more easily get around and utilize my legs and my back, it made a huge difference.
The social interaction that I found the most difficult for me to deal with is the incredible generosity and kindness of people that you least expect it from, people that you don't even know. One of my friends for 25 years chose not to even acknowledge my existence. I believe it's because she has cancer in her family. She was frightened. I ultimately had to sit down and discuss that with her. I said, "You're my friend, come on." And I said, "I think you're frightened, so let's talk about this," which turned out to be the case. But people, this is a wonderful world we live in. People have brought me food. One of the people that I work with opened the front door, shouted out, "Here's the soup," and left. On a day when I could not even get out of bed. It's amazing. It's amazing. And my banner to myself, if you live in this area, there's a grocery store that is really the high-ditch grocery store. It's called Gelson's. And my success story to myself was I got all dressed up in my fishnet stockings and my highest heels that I could walk in without falling over, and my St. John knits, and I went in there bald as a blue jay into Gelson's and did my shopping, and I just held my nose up in the air, and I was so proud. And that was my proof to myself that I could do it. All those Newport Beaches and the big diamonds, here I am, with my little bald head, and I'm standing in my line with my little number at the deli. That was my proof to myself that I'm okay.
That my heartfelt thank you to sponsoring something like this. I think that you're reaching people at the core of their being, and just the respect and it's almost a sister love, just that it's okay to care about one another, and to realize that breast cancer is here and it's not going anywhere, that people are surviving. When I first found out, I really thought, okay, I want my kids to do this, and but that wasn't it. It was not the case. That life goes on, and here we are, and 5 years later, and very, very happy and healthy and working and raising my teenage kids, which is not so easy. That cancer was tough, but it's not what it was before. But just to be reminded that somebody cares about you, still remembers that it's a team effort, and that we're all helping, and you're giving your time and all your energies to women. It's just because we really don't have time to get sick, and as women we just don't. And when we do, it's nice to know that the education is there, and that people are working as a team and embracing and helping heal one another.